Good afternoon. How was the Venlo burger? Good? Let me ask you some personal questions. Which one of you is in a romantic relationship? Please, raise your hand. I'm not hitting on you, trust me, no. Which one of you is lucky enough to have a couple of friends around? Again, a lot of people. So conclusion, you all have a lot of people around you. So, which one of you knows someone who suffers from mental distress or even a mental disorder? It's a lot harder to raise your hand now, isn't it? 1 out of 4 people in the Netherlands suffer from mental distress, and 1 out of 10 people suffer from a condition that we could diagnose as a mental disease. So please look around you. My talk is about you and the people in your lives. I want to show you how our relatively non-severe mental problems can become from bad to worse very quickly, and how often we create these situations ourselves. I also want to show you how our healthcare system fails to address complex problems and how we can use the power of suffering in order to evolve. I want you to meet Jane. Now, we all know Jane. She could be your neighbor, your relative, your average colleague. Jane is a 40-year-old woman, and she is married, has 2 children, a son and a daughter, and she works as a secretary in a large company. One day, Jane doesn't show up for work. She was feeling tired for a while, and she reports to her family doctor, and he advises her to take a good rest. So that's what she does. She goes home and she takes a good rest, and this rest takes up to 4 weeks. After 4 weeks, she gets back to work. 6 months later, she drops out again. Same symptoms, but worse. Again, she reports to her family doctor, and he diagnoses her with burnout. He prescribes her antidepressant medication, and again advises her to take a good rest. This time, this rest takes up to 4 months. After these 4 months, she goes back to work, still on medication. 2 months later, she drops out again, 3rd time within a year. Severe depression. She's referred to specialized mental health care for very intensive treatment, and after 1 year of intensive treatment, she ends up at home, losing her job permanently, still depressed. So what's going on? Why is her medication working? Why isn't the therapy working? The real problem that Jane is facing is that she has an addicted son, stealing from her every day, manipulating her every single day, lying to her, threatening her. So every time she was sent home to take a rest by her family doctor, she was sent straight into hell. The question that comes to mind is, why did Jane tell her family doctor about her addicted son? She only asked him to help her with her depression. But on the other hand, the family doctor knows her son. In fact, he knows the whole family, and he also knows that her son is addicted. How come he's only focusing on the symptoms Jane is presenting? And how come that the specialized mental health care is exactly doing the same thing? That's because they're doing their job. The family doctor is doing his job well, focusing on the symptoms his patient is presenting and treating them, scaling up, as does the specialized mental health care, following protocol and treating her with so-called evidence-based treatment. It is, however, the system that doesn't allow them to focus on the main source of the problem. The system is broken. It is the system that does not address complex situations like Jane's adequately. And it is this system failure that made me, as a mental professional healthcare worker, thinking about a drastic change in the way we help people like Jane. And to do so, I want to introduce you to the MAD approach. MAD stands for Motivation Analysis Diagram. And MAD is based on the principle that the level of suffering influences our motivation to take responsibility for our own recovery. And it is taking this responsibility that is a fundamental element in any effective treatment. And in order to show you that it is a real diagram, this is how it looked like. But it tries too far to fully explain the model in full detail. But I will show you its main principles. And the first principle of the MAD approach is that the degree of suffering influences motivation. As you can probably imagine, that if my level of suffering is too low, then I probably won't be motivated to change my behavior or make other choices. On the other hand, if my level of suffering is too high, the chances are that I'm not able to change due to too much pain or pressure. So if I can influence your level of suffering, then I can also influence your behavior. In the case of Jane, the family doctor and the specialized mental health care decreased the level of suffering by treating her symptoms. But therefore, they also decreased her motivation to address the main source of the problem. So, influencing the way of the level of suffering is a key element in the MAD approach. The second main principle is that MAD focuses on the main source of the problem instead of the symptoms that are presented. Again, in Jane's case, we stopped her treatment. We also stopped her medication, and all we did was follow up. We only monitored the level of suffering rising again. Eventually, she opened up, she told us about her addicted son, so that's what we did. We treated her son's addiction, we gave him the care and attention that he needed, and we also provided him with an alternative place to live. Within 4 months, the symptoms of Jane cleared without any additional treatment. The MAD approach has been proven successful in the past 3 years within my company, and as a comparison, up to 85% of the people who are treated in regular addiction healthcare will fall back in their former habits within the first year. 85% will fall back. Using the MAD approach, we are able to reduce this fallback to only 10%. And just imagine the personal benefits for our patients. Imagine the social benefits, or even the financial benefits. It is my personal mission for the upcoming years to make this MAD approach trainable and therefore accessible for every professional healthcare worker. But you also can start using the MAD approach today, helping your relatives, helping your loved ones or colleagues. And in order to do so, I have 3 recommendations for you. First one is recognize suffering. In order to do so, keep asking questions. Again, it's no rocket science, but try to figure out what is really going on here instead of jumping to conclusions. Try to detect the main source of the problem. The second one is stop focusing on what people want. Start focusing on what they really need. These 2 things are not the same. The third one is that nobody likes to suffer, it hurts. But instead of reducing the pressure, we can use it as a powerful tool for you to evolve. So next time, tomorrow or Monday back at work, next time you meet your Jane, I want you to remember these recommendations. I thank you for listening.